Welcome back to Midday on this Friday. The struggles of 2020 stretch on, weighing on all of us. We made it through Thanksgiving, but the idea of skipping travel and changing more holiday plans is making things harder. And already we've actually seen a rise in depression and anxiety in our country. Joining us now this morning, we are so happy to have him here, is Dr. James Pennebaker. He is a psychologist and professor at the University of Texas at Austin. And he is with us today to talk a little bit more about mental health. Dr. Pennebaker, we're so happy to have you here today, and I want to kind of just dive in with this. And I know that you have been studying mental health for years now. What are some things that you have been seeing these last couple months that you really have just never seen before with people and some of these issues they're experiencing?
We've actually been looking at how people in general across the United States have been just generally responding to COVID and other topics. This has been, as you know, it's been a rather tumultuous time, what with COVID, Black Lives Matter, the election. Anyway, we've been able to go through to online sources like Reddit and looking at how people in various cities are just about things. And what we find is that the level of anxiety has increased, probably fivefold since the beginning of Reddit started in 2008. The impact of COVID is so hard to even convey in terms of how big these effects are. And since COVID started, we did see these huge increases in anxiety, and then some increases in sadness, and actually some drop in anger initially. But much to certainly my surprise, what we've discovered is, yes, anxiety has dropped from the original very high levels. It's slowly been dropping. But the level of sadness, feelings of depression and hopelessness have actually started to rise at a fairly alarming level since about mid-September and early October. And this is something that I was not expecting. I just assumed that the peak would be in the first month or two of quarantine back in March and April. But in fact, things got better in the summer, in the late summer. But since September, there's been this kind of steady rise in the degree to which people are expressing in their language, and also the way that they are filling out questionnaires, that they are increasing their levels of anxiety, a feeling of isolation, more so than they did even at the beginning.
I'll be honest, even personally working in this industry, there are days it can be overwhelming, and sometimes, people talk about the doom and gloom and feeling like a lot of information coming at you at once. What are some ways that people can, just small little things, people can maybe start doing day to day?
Well, I think there are two or three things that we know. There's a lot of literature that supports this. The first is social connections. And that's what's so hard about this, is the fact that we're all essentially locked up in our cubicles, wherever we might be. But the ability to reach out, whether you're talking to somebody on Zoom or by phone or by smoke signals, it doesn't matter, but social connections are critical. Another issue is if you're finding yourself obsessing about something too much, worrying about something, which, by the way, is very easy when you're isolated. One way to help clear your mind is to try writing. There have now been studies done on this over the last several years. Setting aside 15 minutes a day for as little as 3 days or 4 days, and just writing to yourself. It's called expressive writing. So if you find yourself obsessing about or worrying about something too much, if you're getting up in the middle of the night because of it, set aside 15 and just write about it. Explore your thoughts and feelings. Why am I feeling this way? What's the cause of it? How should I be approaching life? In other words, this is writing for you and you alone. And the research suggests this can often be really valuable. And I guess the third thing that most people would agree is really beneficial is exercise. Just going for walks. Put on your mask and go for walks. And try to push yourself a little bit to get out. So those are my kind of three short-term helpful fixes. They're free, they are easy to do, and probably won't kill you in this anxiety-fraught time.
You are wonderful. I really appreciate you sharing those tips with us. Certainly a tough time, and hopefully someone out there heard everything that you just said and can apply that daily. Thank you so much. Dr. James Pennebaker, once again, is a psychologist and professor at the University of Texas at Austin. Dr. Pennebaker, thank you so much for being with us here this morning.